Today I will be discussing gene therapy. Within this discussion, I will be going over the benefits, disadvantages, controversy, and history of gene therapy. I'd like to start off with a question to get you thinking. When does life begin? When do you consider a person's life to begin? In Japan, personhood is obtained when an infant utters its first cry. Among the tribes of northern Ghana, a child is said to acquire its humanness 7 days after birth. For some Aborigines, personhood is not obtained until the child is named, which usually doesn't happen until 2 or 3 years after birth. I'll continue by giving you a little bit more background information. According to the book Biology and Embryology, a gene is a unit of heredity that is transferred from parent to offspring. Now, gene therapy is the use of DNA as a pharmaceutical drug. This concept uses genetic material to treat infected genes and uses stem cells to later repair damaged organs. Backing up to the beginning, when we all were just starting to develop, we had a type of stem cell called embryonic stem cells. When we got older and more fully developed, we no longer have these embryonic cells, but instead we have somatic stem cells. The major, most important difference between these two is that the embryonic stem cells act like shapeshifters, and they can become any type of cell, whereas the somatic stem cell can only become a cell within the area that it came from. For example, an embryonic cell from the nervous system could be used to repair an organ within the muscular system, but a somatic stem cell from the nervous system would only be limited to repairing organs from the nervous system. Well, now you're thinking, this is fantastic. We might actually be able to find a cure for all those awful diseases. Well, here's the reason we're not doing so. Embryonic stem cells have to be harvested from an embryo. There are 2 ways a scientist can do this. They can extract them from leftover fertilization procedures, since these procedures generate many more embryos than are actually transplanted, or they can get germ cells from miscarried pregnancies. The problem is, people think that this is an unethical use of science because it involves the use of a human embryo. Historically, we've struggled with similar topics, such as abortion, where the church would treat the procedure as homicide intent. However, we used to not have an issue with fetal ethics, but that was long ago when the desire to raise strong males for battle led the ancient Spartans to frown upon abortion, although it was completely acceptable to most ancient Greeks to leave a sickly, weak, or deformed child on a hillside to die of exposure. The fact that these embryos could be used to cure something as sufferable as cancer is essential to science and current disease research. But the controversy is holding back advancements. I say we give gene therapy a chance. If these scientists are extracting the embryonic cells safely, then I feel the procedure is entirely ethical. Besides treating cancer, gene therapy has so much other potential. The importance of embryonic stem cells for medicine is enormous. A few possible scenarios include using embryonic human stem cells to produce new neurons for patients with degenerative brain disorders, such as Alzheimer's or Parkinson's disease, or spinal cord injuries, to produce new pancreatic cells for those with diabetes, and to produce new blood cells for people with anemias. Those with deteriorating hearts might actually be able to replace damaged tissue with genetically identical heart cells. And those suffering from immune deficiencies might be able to replenish their failing immune systems. The controversy is overwhelming, but this subject is very serious and vital to the future of medicine. This method of reparation could make massive improvements to our society. But as of now, we are limited due to the large dispute. I'm inviting all of you to choose where you stand in this debate because, as I said before, this topic is essential to medicine today, and especially in the future. Thank you.